Hi, this is Dr. Joannides, Chief Medical Director at Optimum Re, and this is the Optimum Academy, Pulmonary 101, video number 5, and this one is on pulmonary medications. So when you think about it, what's the best way to get medicine to pulmonary problems in the lungs? If you took a pill by mouth, it has to go through your entire digestive system, be absorbed, and then go to all the different cells of the body, including the arms and legs and abdomen and everywhere else. Whereas if you could use an inhaler that sprays medication right into your breathing tubes where the problem is, that would be obviously the best way to go. So that's why inhalers were developed, to develop a certain size of medication that will penetrate through the breathing tubes and then deposit where the action is needed into the lungs. So there are beta 1 and beta 2 agonists and beta blockers. So this is a mini course on things known as beta. Beta 1 agonists or beta 1 drugs like epinephrine increase the heart rate and blood pressure and help with bronchodilation, but you don't want the blood pressure rise and increased heart rate while you're trying to improve your breathing. So rather than use beta 1 agonists, beta 2 agonists were developed like albuterol or Ventolin, and that gives you bronchodilation without the cardiac effects. So much easier on the heart. So that's why today for bronchodilation, we use beta 2 agonists or inhalers. Also, the first generation of beta blockers like Inderol blocked both beta 1 and beta 2 receptors. So that was much more likely, if you were using it for your heart, to have an effect in a negative way on the lungs. So that's why second generation beta blockers like atenolol or tenormin block primarily the beta 1 receptors and not the beta 2 receptors, which we need to help open up the breathing tubes. So I hope that gives you some background on both beta agonists and beta blockers. So inhalers for bronchodilation are beta 2 agonists. So that hits receptors that are going to open up the breathing tubes. So beta 2 agonists, both short and long acting, constitute the frontline treatment for both asthma and COPD. They exert their bronchodilatory effects or bronchodilation effects via beta 2 adrenoceptors, beta 2 ARs, located on the airway smooth muscle. No longer are beta 1 agonists used like epinephrine or ephedrine, even though some people still buy Primatene Mist. Not a good idea since it has a lot of negative cardiovascular effects. Inhaled particle size is important. You want the particle size to be 1 to 5 microns. That gives you the best penetration into the lung and deposit in the lung tissue where you want it. If it's too tiny, like less than 1 micron, it will remain suspended in the air and will not deposit in the bronchial tree. So short-acting bronchodilators, also known as rescue inhalers, are things like albuterol or salbutamol. Ventolin is a typical rescue inhaler. Long-acting bronchodilators, abbreviated LABA, are used on a regular basis, once or twice a day, like formoterol, and they're used every day to help prevent problems in the future. So if you're on a long-acting bronchodilator, which you use regularly every day, and then you have an episode where you have asthmatic symptoms, you would use your Ventolin inhaler as a rescue inhaler. Also, since in lung disease, there's a lot of inflammation that can occur in the breathing tubes, steroid inhalers are also used, like budesonide or Pulmicort, and that helps reduce the inflammatory response in the breathing tubes when someone has an asthma attack. Also, anticholinergics are prescribed in inhalers, like Spiriva, and they may be used once or twice a day as well. So what the drug companies do is they mix and match combination of these long-acting drugs, and you see them advertised on TV. They're very expensive when you get a combination of multiple drugs together. If you see it on TV, it's expensive. So just to give you an idea of how medication can be used, in addition to inhalers, medication can be put into a nebulizer cup, and then the machine is hooked up to the cup and it makes small particles that can be inhaled to reduce asthmatic symptoms. So in this case, on the left, I have the steroid inhaled substance called budesonide, and you break off one of those little plastic tubes, break off the top, and then squirt it into the nebulizer cup. And so those are unit doses. So when you need to get a nebulizer treatment, you could take one Ventolin and one budesonide, put that in the nebulizer, drip that into the nebulizer cup, and then inhale those droplets to help improve your breathing status. So for a baby, since they would have trouble using an inhaler, breathing in and out at the right exact time, we use a nebulizer with a mask to get those particles into the lung if they're having some kind of wheezing attack maybe from a virus. For our older child, as on the bottom left, since it's hard to sequence this, pressing down on the inhaler to get the medication and breathing in, for some kids, what you can use is a spacer. So you just depress the inhaler, the medication goes into the spacer, then the child can just take a breath at their leisure and breathe it deep into their lungs. So a spacer helps with kids. And then you can see on the right, this patient is using a nebulizer, and the medication is put into that cup, and then the little machine generates a mist of that medication so it can be breathed into the lung. And at the middle on top is those unit dose packets, and you just break off the top and drip the medication into the nebulizer cup. So there's an array of inhalers. Mainly now people use long-acting drugs so that they can take it on a regular basis every day to prevent asthma attacks, or if they use medication for COPD as well. So a combination of long-acting bronchodilators, abbreviated LABA, possibly an inhaled steroid, typically budesonide, or a anticholinergic, also called muscarinic antagonist, can be also added to help with breathing. So it can be a combination of any one of these three types of medication. And then we still have the short-acting rescue inhaler that I talked about before. So a new inhaler that's being advertised is breast tree inhaler. It's not for the treatment of asthma. It's been developed for the treatment of COPD, and it has three ingredients. It has the steroid, budesonide, to help with preventing inflammation. It has formoterol, the long-acting beta agonist, and it has a long-acting muscarinic antagonist that inhibits the parasympathetic nerve impulses by selectively blocking the binding of acetylcholine to muscarinic receptors. That's a lot of big words to say that that's the anticholinergic element in this medication that's a combination of 3 drugs. So to give you an idea of how this all works, maybe you can remember back to when you took biology and how agonists in the adrenergic and parasympathetic system work, but in the specifically looking at the action of medication on the lungs, the lung bronchioles, sympathetic drugs like the beta agonists are to improve dilation of the breathing tubes, and the anticholinergic drugs are to inhibit the parasympathetic system, so inhibit constriction. So you've got the bronchodilator circled in red here to give dilation, and also the parasympathetic blocker to block constriction. So you hopefully get the blocking of one and the action of dilation from the other. So hopefully the two work hand in hand, along with a steroid possibly, to improve breathing function. So anticholinergics are used in COPD for their bronchodilator effects, and they're antagonists of muscarinic or parasympathetic receptors, and the blockade of these receptors in the smooth muscle inhibits acetylcholine, thereby relaxing the smooth muscle around the airways and keeping the airways open. So that's why this drug can be added to an inhaler along with the beta adrenergic and steroid medication. So here's another inhaler that you might see, Trelegy ellipta. It's a combination, it's inhaled as a powder containing a combination of a steroid, an anticholinergic, and a long-acting beta adrenergic. So it's one of these combos of 3 drugs. Just to give you an idea, you should follow the instructions very carefully. Whoever is using these drugs to improve their lung function, and you have to follow the instructions closely because each one of these different types of inhalers has its own specific way to use it. So in this one, you have to open the cover of the inhaler first. You should hear a click. The counter will count down by 1 number. So if it starts at 30, you would go to 29. You do not need to shake this kind of inhaler, whereas you would need to shake other kinds of inhalers. It says your inhaler is now ready to use. If the counter does not count down as you hear the click, the inhaler will not deliver the medicine. So you can see you got to be on your toes when you're using these medications in order to get the benefit that you're hoping to receive. So that completes this video on pulmonary medications. Stay tuned to our other videos to complete the Pulmonary 101 course in the Optimum Academy.